Dr. Christakis, let me start with you. And first of all, thank you for being with us today.
Thank you for having me.
It's good to be with you. You've studied pandemics throughout history, so I want to begin by level setting where we are on this one. You know, what we show in our research is that the majority of investors want to make up for lost time, do all the things that we've missed in this last year plus. But at the same time, 77% say a sense of fear will persist for a long time. Can you explain where we are in the recovery and what we can expect in the months and years to come?
Yeah, I mean, I can offer a sense of that in part guided by an understanding of this respiratory pandemic, which is part of a phenomenon of respiratory pandemics that afflict the world every 10 or 20 years, and serious ones like this every 50 or 100 years, and also by reference to going back thousands of years, because one of the most important things to understand is that this way we have come to live right now, which seems so alien and unnatural, and it is, what's important to understand is that plagues are not new to our species. They're just new to us. We think it's so crazy that we have to live this way, but it's possible to frame expectations by looking at the past. And in order to just answer your question, I need to go on a little bit of a digression first, if you'll indulge me, to explain what herd immunity is. Can I go on that digression for a second?
I'm always willing to learn a lot more.
Okay, so herd immunity is the idea that a population of people can be immune from a condition, even if not every individual within the population is immune. So, for example, if you vaccinate 96% of the population against measles, and one of the 4% unvaccinated people gets the measles, you don't get an epidemic because that person has no one to spread it to. They're surrounded by immune people. For a variety of technical reasons I won't go into, that threshold for coronavirus for this pandemic is at least 50%. At least 50% of the population has to be immune before we reach this threshold. And of course, the more the better. The larger, the higher and higher fraction of immune people, the more we can control the epidemic. So where are we right now? You can think of epidemics as having three phases: the immediate phase, the intermediate phase, and the post-pandemic phase. We are still in the immediate phase of the epidemic. We are not, in my judgment, at the beginning of the end of this epidemic, but we are approaching the end of the beginning. And in that immediate phase, we are feeling the full force of the biological and epidemiological impact of the epidemic as the germ sweeps through our population. And it will continue to sweep through the population until we reach the herd immunity threshold. And we'll reach that threshold either naturally, because people get infected and acquire immunity, or artificially via vaccination, which is better. And I think we are going to reach that threshold by the end of 2021, the beginning of 2022, by which time enough people will have acquired immunity, at least in our country, in the United States. And then, of course, the whole world has to do the same thing. And we will then finally put the immediate impact phase behind us at the end of 2021, beginning of 2022. Until that time, we're going to be living in a changed world, wearing masks, having periodic business in school and border closures, having gathering bans, and so on. This summer will be better, but next winter again will be tough in ways we can return to. Having now put at the end of the immediate phase the biological and epidemiological impact behind us, then we will enter the intermediate phase. And you can think of the epidemic as a tsunami that washed ashore and devastated the shoreline. Now the waters recede. That's great, but we've got to clean up the mess. And so you have to understand that we have to cope with the psychological, social, economic, and clinical consequences of the epidemic. As many as 1 million Americans will die of this disease before the epidemic is finally over, but as many as 5 times as many will be disabled by the condition. Maybe as many as 5 million Americans will need medical care during this intermediate phase. Millions of children will have missed school. Millions of businesses will need to be recapitalized. Millions of workers will need to be reemployed. It takes time for us to respond to all of those challenges and opportunities. And that, if you look at past pandemics, takes a couple of years till the end of 2023, beginning of 2024. And then we're going to enter the post-pandemic phase. And I think that is going to be a little bit of a party, similar to what happened with the roaring 20s of the 20th century, but now in the 21st century. I'm almost done with my answer. But the important thing to realize is that if you think about it, we've been cooped up for the last few years, last few months. People have not been spending their money, which is a rational and typical response to plagues. People don't spend during times of plague. But finally, when we finally put the epidemic behind us, all of those trends will reverse. People will relentlessly seek out social interactions in nightclubs and restaurants and bars and sporting events and political rallies and musical concerts. People will start spending money. We're going to see, I think, an efflorescence of the arts and a booming economy, kind of entrepreneurial zeal, I think, will take place. And that'll be the typical pattern if you look at history. I'll say one more thing. I think this summer will be, I'll say two more things. I think this summer will be better for a variety of reasons that we can discuss, but next winter will be tough again, not as bad as this past winter. And the last thing I'll say about this is that all of this forecast depends sensitively on the emergence of so-called variants of concern of the virus. So if we get new variants of the virus that emerge, in particular, if we get ones that evade the vaccine, which is unlikely, I would put the probability between 1 and 10%. If we get new variants that emerge, that could modify the timeline that I've described.
So, Dr. Christakis, let me come back to you and shift gears and focus more on the sociological after effects of the pandemic. I have 3 daughters. I'm interested, kind of the social element, how people emerge as you study pandemics through time. And you talked about this intermediate period. We found in our research, 55% of investors are worried about the long-term effects of COVID on the economy, healthcare, and education, just to name a few. As we enter in this next phase, what are the issues society will have to deal with as a result of COVID? And you talked about this intermediate period.
There are a number. It's interesting. I was listening to Salita's, some of the industries that she mentioned and some of the sectors. And of course, some of those like hospitality are things that I've been thinking a little bit about too, but there are others as well. For example, the higher education, what kind of disruption will the pandemic have induced? All these people moving to Zoom teaching, for example. Some people are going to want to stick with that even afterwards when it's no longer necessary. Of course, the working from home disruption, we're already beginning to see people saying, I kind of like working from home. A lot of that's going to persist, which is going to have implications for the real estate market. If people learn that they can work from rural or suburban areas and don't have to return to the city, and if their employers see, oh my goodness, I can save money, it'll affect rents, it'll affect the whole real estate industry as we rejigger where people are. Many people have been talking about this, of course, as well. Hospitality, I think, will eventually come back with a vengeance, but business travel may be modified. The time when someone would assume the expense of flying across the country just for a business meeting that was not so important, I think there'll be a rejiggering. Of course, business will still be transacted face-to-face. I think that's essential, and that's not going to go away. But some of the details about how business is transacted and how that affects the hospitality industry, I think, are worth thinking about. There's going to be a number of ways in which it will be difficult to undo some of the changes that were prompted by the disruption of the epidemic. For example, this is in all kinds of ways people aren't even thinking about, like juries, for instance. A number of states said, we didn't want to bring during the pandemic juries of 12 people together in the jury room. So why don't we switch to a 6-person jury, like is often done in some federal trials? So they tried that out. Maybe they'll want to continue that, for example. Or medical care. We used to all go in to see the doctor for a prescription refill, which was silly and was never really necessary. People will see, why do I have to do that? That will maybe change. Or remote learning, like I mentioned earlier, or other broader changes that people, I'm beginning to see some reporting on this, although it's something I've been thinking about for a while. The gender parity in the workplace may be unexpectedly affected by the pandemic. It is still the case in our society that in the modal couple, men are on average 2 years older. In the modal heterosexual couple, leaving aside homosexual couples for a moment, the man is typically about 2 years older than the woman. And because of this age gap and because of occupational differences, men still earn more money than women. And during the pandemic, many couples, when schools closed, were sitting around their kitchen table and deciding how to cope. And because on average, women are less averse to spending time with her children than men, many couples made what was for them an eminently rational decision. They said the man is going to continue to participate in the labor force. The woman is going to stay home with the kids. A very kitchen table discussion, which every family is allowed to make when faced with whatever challenges they want, leaving aside any kind of broader considerations. But if you think about it, if millions of couples have made these decisions, we may see a change in women's labor market participation. 10 years from now, we may look back and look at variance in male and female earnings, or the allocation of men and women across industries and occupations that will be echoes of this pandemic. So there are all kinds of ways, or handshaking, I'll finish with that. Handshaking is gone. Will it come back? Will people start shaking hands again? Many other societies around the world greet each other without physical contact, but we shake hands in our country, but not now. So the point is, there are some direct effects of the epidemic, like working from home and hospitality, travel, that we can all see, but there'll be these other subtle effects that will be echoes of the pandemic, whether it's labor market participation effects, handshaking, civil procedure and jury trials, and so on, that we may not yet fully appreciate.
Very, very interesting. I'm a handshaker and a high fiver. I hope that comes back into society. I was listening to you, whether it be business trips and flying across the country and talking to a number of clients. I think people in this last year are trying to figure out all the things that they learned that they would incorporate into their life in the future, whether it be how they work, how they spend time with their family and friends. And I think that does carry forward for a long period of time. The interesting thing that you said was just, how this has impacted women differently than men. We just published our most recent Own Your Worth segment, which really describes how women are looking more towards sustainable investing, having an impact and aligning their investing with their resources. So I think some key takeaways. Thank you.
Could I add something? One of the things that you see during times of plague, and you mentioned it at the opening, is that during times of plague, people search for meaning. And they do that for a variety of reasons. They think about their own vulnerability, right? When death is in the streets, people think about, oh my goodness, what's important to me in my life? And they also think about what's important in the society. What kind of society do I want to live in? What is a just society? What's a good society? What's a healthy society? And I think as a nation, we've been doing a lot of reflection on this. For example, we've seen during times of plague, we see a rise in religiosity. We're seeing that now. We're seeing a rejiggering of people's occupational choices. For example, medicine and nursing and public health are booming. Young people are thinking, what's meaningful and important in my life? Essential workers are seeing meaning in their work, right? The guy that was driving a truck across the country before thought of it perhaps as an occupation, and now he sees himself as an indispensable member of our society, delivering crucial goods in times of need. And finally, it picks up on what you just said, which people's philanthropic activities are rejiggered by this, because people are thinking about what's important to them in their lives, what's important about the society they live in, and this, of course, affects how people allocate their resources, just as you mentioned. But there's actually this very big connection between climate change, for example, and pandemic disease. There's, of course, a practical connection. As the climate changes, we come into more and more contact with wild animals, and so we are likely to get more and more of these diseases leaping from animals to us. But there's also this broader way in which I think people have seen the role of science and the role of planning to deal with global catastrophes. And there's a way in which climate change and pandemic disease are similar conceptually. So all of these reasons you see connect the sustainability. And I think because of that, I think people may be paying more, ironically, in other words, because of the pandemic, I think people may be paying more attention to climate change. And they may be better prepared mentally to listen to scientific and other recommendations, and better prepared for reasons of meaning to work together to address them. All of which I think may have investment implications of the kind that Salita was emphasizing.
Doctor, the first one comes in, it's for you. I'll read it right here. How will the experience with the pandemic phases differ for those who are vaccinated versus those who are not vaccinated?
I think this is a classic issue with respect to all public health issues, which is the difference from an individual point of view and a collective point of view. So policymakers may make recommendations at the national level, or you yourself, if you were deciding what's good for the country, might recommend a course of action, which is not necessarily a course of action you would implement for your own household. Something that's good, for example, closing schools might be good for the community, but closing schools might be bad for you and your family. So there's always this potential difference in perspective from the individual and collective point of view. So everything I was talking about was from a collective point of view. What is the broad sweep, the arc of what's going to happen in our society? Individuals within that will have different experiences. And that includes the difference between those who are vaccinated and those who are not vaccinated. So if you're vaccinated, you are much better off. You can travel more easily and more safely. But nevertheless, you live in a society where these changes are ongoing. You, even if you're vaccinated, you, for example, you benefit from living in an area with low levels of virus because the vaccine is good but not perfect. So the vaccine confers 95% protection, but if you also live in an area with very low levels of virus or an area with very high levels of other people who are vaccinated, you get an even greater benefit. So for example, now that I'm vaccinated, I might gather with a small group of people in my household. If I was unvaccinated, I wouldn't do that. But even if vaccinated, I put on a mask when I go to a grocery store, which I'll be indoors with a bunch of strangers whose vaccine status I don't know. So the answer to your question is that to sum up, the arc that I gave applied to the society at large, and to the extent you're a member of the society, you will be affected by that. You know, taxes are going to go up, schools are going to still close intermittently. Our society is going to change whether the individuals within it are vaccinated or not, and that'll affect everybody. But your own individual way of going about your business is clearly enhanced by being vaccinated.
Well, I'll follow up. Another question from the audience came in, so I'll just follow up with that. And around vaccination, the question is, how do we know that there's only a 1 in 10% chance of a variant that can evade the vaccine? Our confidence level there.
Okay, so again, that's that's a kind of virology and epidemiology, and there's a lot of science there. Let me just back up by saying the typical trajectory of pathogens with time is that they become more and more benign. In other words, from a Darwinian point of view, the germ doesn't want to kill us. It doesn't serve its interest. What it wants to do is sicken us, but not kill us. So we move around and transmit it to other people. So a germ that is too deadly too fast and fells its victims eventually can go extinct, like some of these Ebola outbreaks. They're so deadly and so rapid that they don't spread around the world. Ebola is almost too deadly for its own good. However, there can be exceptions to this, and the thing that I just said, which holds over a broad sweep of time, might not hold over a short sweep. And the virus, in principle, can do anything it wants, quote unquote. And we are seeing the emergence of new strains that are, in fact, more deadly. The B117 strain is about 30% more deadly. The so-called India strain is about 30% more deadly. And they are more infectious. They spread more easily. That is definitely happening, and that is bad news. And that is something that we need to track. Now, the good news is that all the vaccines, all the mRNA vaccines in particular, but all the vaccines that are out have so far been shown to protect against these variants. The vaccines are so good, they induce a kind of super immunity so that even though these variants evade them slightly, they do not evade them completely, at least not in most people. That's great news. However, it is remotely possible that new variants of concern might emerge through mutation where those variants of the virus might evade our vaccines. It's difficult to put a percentage on that. I don't think it's more than 10%, but I don't think it's below 1% either. The reason, and I'll say one more thing and then I'll shut up, the reason that we can kind of bound this is that so many millions of people have become infected and the virus has spread so worldwide that in essence, the argument is the virus has had enough of a chance to explore the genetic landscape, the so-called Darwinian landscape, enough that if such a variant were to be beneficial to emerge, it probably would have emerged already. So the fact that we haven't yet seen it is sort of good news, but it doesn't mean it's like the black swan idea. Just because we've never seen a black swan doesn't mean they don't exist. It could happen, but it's unlikely. And of course, the pharmaceutical companies are scrambling to develop boosters, and I think we will have a rapid response should this eventuality materialize.
Doctor, you want to add to that?
No, I was just going to add on the taxes. I mean, one of the macro things that's worth to remember is that if you compare the world today to the world 2 years ago, the world is different now. There's a virus that's spreading and is a serious virus, and it is going to destroy wealth. I mean, the virus intrinsically is worse. No one could argue it. We're better off with a virus than we were without it. So in some sense, some level of taxation, someone has to pay for it. So the cost that the virus imposes on the economy, whether by whatever means, inflationary pressure, taxation, whatever it is a feature of the virus. It's an inevitable feature. So as Salita is emphasizing, proper and prudent planning, like accepting this reality and then planning accordingly, is crucial. We can't pretend like the virus didn't harm us. It did harm us. There's going to be some necessity of coping with that one way or the other. And the question is, how do individuals cope, which is the topic of conversation right now, and also how does the broader society cope, both of which are important.
Dr. Christakis, you mentioned the cost of the virus, which I think is a nice on-ramp to this next question, which is, Dr. Christakis, it's said that approximately 8 million women left the workforce during the pandemic. How do we reconcile this with many daycares not yet open and return to office starting back up?
Yeah, I mean, that's exactly what I was talking about, which is that for the various, stereotypic reasons, not every woman prefers childcare to every man. I mean, we're speaking in stereotypes right now. I just want to be very clear so I'm not misunderstood. But that statistic you just said is exactly what I was talking about, which is that on average, we've seen a tremendous exit of women from the labor market. Now, and for a host of reasons, you have to also understand this is a problem that affects the middle class more than the lower working class or upper. So super rich people, women might have been working, but they have wealth or their partners have wealth. And they say, now that I've been forced by the pandemic to stay home with my children, I actually like that. And I can afford to stay home. And so I will. At the bottom of the income distribution, people might say, I wasn't making that much money participating in the labor market anyway. After I had to pay for childcare and other expenses, it's not worth it to me. I've now seen what it's like to spend time with my children. So that the particular stress, sort of personal stressfulness of this will be felt in the middle of the income distribution. But regardless, we are going to see a macro effect that I was describing earlier, and that this 8 million people figure that you put on the table summarizes. But to the extent that individuals care, or that we as a society care, in a capitalist economy like ours, money will have to flow or wages will have to rise to solve the problem. In other words, if we start spending more money on schools and daycare, or we subsidize it through daycare programs that employers provide or the government provides benefits, then we will respond to this demand on the part of people or to our policy agenda and redress some of these gendered effects of the economy. In other words, we're going to have to pay more for childcare if we want to make it possible for us as a society or for individuals to address this challenge that the epidemic has put on us.
Thank you. Maybe I'll pose this as our last question, where you study pandemics throughout time, but I find that your underlying message is always hopeful. You even said, the spread of germs is the price we pay for the spread of ideas, which I find an optimistic way of looking at things. Maybe some more insight. Tell us why you feel hopeful and why we should too.
Well, first of all, I'm an optimistic person by nature. I'm just dispositionally optimistic. And I also am scientifically optimistic about our species. We are a remarkable species. For example, we evolved to love each other, to form sentimental attachments to our partners. This is rare in the animal kingdom that we do this. We evolved to befriend each other. This is exceedingly rare. Many animals mate with each other, but we also form long-term, non-reproductive unions to other members of our species. Namely, we have friends. We are friends with people who are genetically not our kin. This is very rare. We do it, elephants do it, certain other primates do it, certain whale species do it. We evolved to be kind to each other. We are kind to strangers. Also very rare in the animal kingdom. We evolved to teach each other things. So we work together and we transmit knowledge. Any animal can learn. Most animals learn. A little fish swimming in the ocean can learn that if it swims up to the light, it will find food there. That's called independent learning. And some animals learn socially. For example, you put your hand in the fire and you burn your hand. You have, by independent learning, you have acquired some knowledge. Fire burns, but you've paid a price. Your hand is burnt. Or I can watch you put your hand in the fire, and I acquire almost as much knowledge, but pay none of the price. That's incredibly efficient, and that's called social learning. We do that, and some other animals do that. But we do something that's even more amazing, is we teach each other things. We set out. It's not just by I observe you building a fire and burning a hand, and I learn from that. No, you set out to teach me how to build a fire and to teach me not to put my hand in the fire. This is exceedingly rare in the animal kingdom, but we do it. So we have all these wonderful qualities: love, friendship, cooperation, teaching, that we evolved to have. And one of the arguments that I've made is that we come together to live socially in this way, to share ideas, for example. But in coming together to live socially, we expose ourselves to risk of germs. Hence, the spread of germs is the price we pay for the spread of ideas. By coming near you, I can learn from you, but now I might get a contagious disease from you. And if we lived separately, we wouldn't have that risk. But here's the point. If you look at how we have responded, we as a species and as a nation and as a planet have responded to the pandemic, we've responded by working together. Our society has had to come together, for example, to ironically live apart. We have acquired knowledge from our ancestors about what to do in times of plague. Our scientists and doctors have worked together to invent these vaccines. Tens of thousands of patients have signed up for the trials in an altruistic fashion to test the vaccines, to produce the knowledge that we are now using. So the irony is the spread of germs is the price we pay for the spread of ideas, but equally it's the spread of ideas that we must use and are using to fight the germ. We are cooperating with each other. We are manifesting many wonderful qualities. And if you'll allow me, and I wasn't planning on it, but if you just give me a second, I'm going to grab it. There's a wonderful novel written by a French philosopher called Albert Camus. The novel is called The Plague, and it's acquired new meaning. Camus writes this book about 70 years ago. It's set in Algeria in a town of Oran, and it's based on a cholera in the 1940s. It's set. It's a novel, and it's based on a cholera outbreak from the prior century, and also informed by bubonic plague outbreaks throughout Europe in centuries past. And it's about an outbreak, and the protagonist is a man by the name of Dr. Rieu. And there's a line from the novel that I find answers your question. If I could just read it. It says the following: Dr. Rieu resolved to compile this chronicle so that some memorial of the injustice and outrage done them might endure, and to state quite simply what we learn in time of pestilence, that there are more things to admire in men and women than to despise. And that's exactly how I feel. And I do believe that this epidemic has presented many opportunities for us, not just investment opportunities, but also opportunities to think about meaning and to think about the kind of society we live in and would want to live in.